Buoy Health Insights, heartbeat sound in the ears. Hello and welcome to Buoy Health Insights. If you've ever experienced a thumping sound in your ears, you might be dealing with what is known as pulsatile tinnitus. In today's episode, we will delve into this condition, uncovering the potential causes, associated symptoms, and when it's necessary to seek medical care. Pulsatile tinnitus, which can feel like hearing your heartbeat in your ear, can stem from a variety of issues, such as Meniere's disease, which impacts balance and hearing, earwax buildup, or even temporomandibular joint dysfunction disorder. Let's explore what could potentially be causing this sensation for you. One common underlying issue is changes in blood flow or blood vessels, which may be a result of high blood pressure or atherosclerosis, the buildup of plaque in your arteries. Inner ear problems or a heightened sense of awareness brought on by stress or anxiety can also cause you to hear your heartbeat in your ear. If you're looking for a diagnosis or treatment plan, it's crucial to consult with a medical professional who can accurately determine the root cause and suggest appropriate treatment options. Apart from the reasons we've discussed, pulsatile tinnitus could indicate an emergency if it begins suddenly or severely and is accompanied by additional symptoms such as dizziness, nausea, headaches, or vision changes. These could signal a more severe underlying condition, such as an aneurysm, necessitating immediate medical attention. For those wondering if there are any home treatments, the answer is yes. While treatment should ideally target the root cause, some home remedies might ease the symptoms. These include relaxation techniques to combat stress, avoiding triggers like caffeine or loud noises, sound therapy to mask tinnitus, regular exercise to improve blood flow, and dietary changes to improve overall health and reduce inflammation. Now, let's touch on some specific conditions that could lead to pulsatile tinnitus. Temporomandibular joint dysfunction, or TMJ disorder, is one such culprit, causing pain and dysfunction in the jaw joint. It's a condition that can lead to dizziness, pain, and clicking sounds from the jaw, and it affects more women than men. Pseudotumor cerebri, another potential cause, is characterized by increased pressure inside the skull for reasons often unknown, presenting with headaches, pain behind the eyes, and vision changes. Myofascial pain syndrome can also lead to pulsatile tinnitus due to pain from muscle strain or injury through overuse, stress, or poor posture. Lastly, Meniere's disease affects the inner ear, leading to symptoms that include severe attacks of vertigo, tinnitus, pressure inside the ear, and progressing deafness. For today's takeaway, remember, if you hear your heartbeat in your ear and it's a new or persistent symptom, don't ignore it. Consult with a healthcare provider to explore potential causes such as high blood pressure, infections, or other related conditions. Before we wrap up, a quick reminder. If you found this video informative and helpful, please hit that like button and subscribe for more insights from Buoy Health. Until next time, take care and be well.